Hey there. How are you? My name is Megan Clanahan. I am the co-owner of Houston Moms Blog, and it has been our goal during these crazy COVID and quarantine times to bring you education from various partners around the community and give y'all the information that you need to know as parents and as moms to make informed decisions. So I'm so excited to have Dr. Tamisha Jones with Legacy Community Health. She is the medical director over pediatrics there. And so we are going to ask her a bunch of questions that you guys have wanted to know, and hopefully give you a little more insight, a little more comfort on what's happening as it pertains to well checks. And we're going to go through all of that with Dr. Jones. So Dr. Jones, I'm going to turn it over to you. Would love to just hear a little bit about you. Where are you from and how long have you been with Legacy?
Sure. So as you mentioned, I'm the medical director for pediatrics at Legacy. I've been at Legacy for 8 years. I trained here in Houston. So I went to Baylor College of Medicine and I did my residency at Texas Children's Hospital in Ben Taub. And I'm excited to be here and answer all of the questions that you guys have.
Perfect. So we're just going to launch right into it. Obviously, so many of our families are worried about keeping our kids safe from COVID-19. What is it that you, as a medical director over pediatrics, want families to know during this time?
Yeah, I mean, I think there's still lots of questions that we have, but there are some things that we know pretty much for certain. And that's really, the great part is that those are easy things like hand washing. So making sure that we're, teaching our kids is a great opportunity to teach them about hand washing and singing the happy birthday song or ABCs and showing them how to get all the different parts of their hands. Mask wearing is important as well, and doing the social distancing. So we know that those methods work to help keep our families safe and to keep us safe as a community. And the nice part is that those are things that are pretty easy. Even just coughing into your elbow, those are things that, this is a great opportunity to share how to do those things properly with your kids. So it gives us a nice window into to being able to express how to do that with our families.
Yeah, so I think that's been the most interesting thing is to start to see them create these habits of sneezing or coughing into their elbow or, doing elbow bumps instead of, high fives. And I do that now. And so I think it's interesting, especially as we launch into flu season, which we'll get to, that, maybe some of these precautions that we're having to take for COVID will help with that whole germ spread too in different things. And so we can definitely talk about that. One thing that I started thinking about, and I'm totally guilty. So my twins, I have twin 10-year-olds. They turned in June. We just now took them for their well checkups because we've just felt a little uncertain about how it all works and, what's safe, what's not. We didn't want to take any unnecessary steps.
That's right.
So what would you say, because especially I've heard pediatric immunizations are dropping. The rates are dropping during COVID.
Yeah.
So why does this concern y'all? What has you worried about that?
Yeah, so I'll just say first, that's pretty normal. I mean, I think everybody felt uncertain. And so your first thought is just to keep your family safe. And so it's okay to have made that decision. But yeah, we are concerned just as a community around immunizations and our immunization rates because we have seen them decline so dramatically since COVID, really took hold in March. And what that means is that, our community is not as vaccinated and not as immunized as they would normally be. And we all benefit from something called herd immunity, which means that if the majority of people are vaccinated depends on the disease, but somewhere between 70, 80, and sometimes in some cases 90%, if we're not at those rates, then we start to lose that herd immunity. And what herd immunity is it protects those in our communities that aren't able to vaccinate for whatever reason, or that don't vaccinate. So for the 20 or 30% of families, or sometimes it's even less, we hope it's less, that choose not to vaccinate, or that for whatever reason the children are sick and aren't able to receive vaccines, they're still protected if the majority of the people in the community are vaccinated. And as soon as we lose that herd immunity, then now our most vulnerable kids are at risk, and we start to see spread. And we've seen a little taste of that with measles. There was some measles outbreak out of Disney World a few years back, and we've seen it a little bit with pertussis as well. And that's just with some small drops. But if we have a really big drop in vaccination, then we are really in trouble, because we'll have COVID, and we'll start to see some of these outbreaks that we haven't seen in a long time. And what I think a lot of families don't understand is that many of these diseases that we vaccinate against now, our younger doctors, if you've finished in the last 15 years or so, you've never seen measles. You may have never seen measles. You may have never seen mumps. And so it's even more difficult to diagnose something that you've never seen. And so as we start to see more and more of these diseases, they may kind of slip through the cracks too, because they're things that a lot of the newer physicians haven't even seen before, because we've done such a good job at immunizing against them.
Gosh, what a good point, and also a little frightening, but it makes total sense. So given that, what would be your encouragement to the Houston community who's listening, if you have kind of been putting off getting your vaccines for your children, what would be your encouragement? Assuming that they are healthy and you're ready to go for their normal vaccination.
Yeah, I would say that the majority of health centers, Legacy included, have taken a lot of steps to make sure patients are well. I mean, as pediatricians, we know you're bringing in your healthy kids, right? I mean, that's huge, right? You're bringing in your healthy kids, and they have to leave just as healthy or healthier than you brought them in. And so the medical community, we're doing everything that we can to make sure that we make our clinics safe spaces for kids to be able to get their regular immunizations. And so, yes, definitely, this is a great time to go in and get those immunizations. I would say now, because we're not yet in the middle of flu season. We've seen our rates of COVID decline pretty significantly over the last few weeks. And so this is a great time to go in if you've waited, or you haven't felt certain about when to go in and get those back to school kind of shots and visits. This would be a perfect time to go in and make sure that your kids are up to date and have all of the preventative care that they would normally get at those visits.
I think that's such an important point, because always during, let's say December to January, I get really nervous going to the pediatrician, because we know we're in the throes of flu season. So now it's kind of this I won't say peaceful moment, but it does seem a little bit more chill, where we can, go in and know that that you guys are, wearing all your PPE, and, all the screenings are done, completely safe. And so in that same vein, I'm sure your same encouragement would be not to keep holding off on your child's wellness checks as well. I mean, I needed to know where my kids were growing and what all was coming up. And, we were 2.5 months late. So I'm sure that same encouragement applies.
So it's not just the vaccines. I mean, the vaccines piece is huge, but it's also all of the other developmental screenings that happen, all of the lab work that might happen to screen cholesterol, to screen for anemia, to make sure that kids are developing appropriately. All those things happen in that well visit. And so important. We know that preventative care is such a huge piece of pediatrics in general. So it is important. And this is a very good time, because even in a regular season, usually September is kind of a lull. The back to school is over, and it's right before cold and flu season. And right now, because we've seen, some dip in the COVID rates, and we are in that kind of lull period. This is a really good time to go in and be seen and make sure that you get that preventative care and any vaccines that you've been missing. And in flu, getting the flu shot now too. So it's a great opportunity to do that as well.
And I assume y'all have the flu shot available now at your clinics?
So we don't yet have, probably later this month, later in September, we'll have the flu vaccine. But a lot of usually the first people to get the flu vaccine are like Walgreens and CVS and some of the kind of local drugstores, because they are like sort of international. And then more of the local places like, your local doctor's office will have it. So probably later this month we'll have it. But I would definitely ask where, if you're going in now, I would definitely ask about it, because some places do already have it.
Perfect. So moms, here's your homework. If you were like me and waited 2.5, 3 months to get your well checkup, go ahead and make that appointment and just get it done. I mean, ours, I was so impressed. It was, it was smooth. I felt safe. And then I can check the box for another year. And so
it's the best time. Because we're doing such a good job separating sick and well now. I mean, better than ever before. So this is a great time. This is a really good time.
For sure. I've never felt safer, to be honest.
Yeah.
And I think, now's the time. My kid wasn't mad about missing a little virtual school. So, moms, go get it done. So kind of switching gears, we hear a lot now about telemedicine.
Yes.
And I know that's something that you guys work with. So tell me a little bit about telemedicine, especially as it relates to the pediatric side.
Yeah. So, it was something that we ramped up pretty quickly because we wanted to make sure that we were still available to our families, particularly for sick visits and just questions and all kinds of things. And I think that it really helps because it helped families get a peek back into the clinic to make sure that they knew, like, hey, we're still here, it's still safe, things are still okay. But we can do so many things over telemedicine. It's really, most of the sick complaints that kids have, we're able to manage over telemedicine. Okay. And we've also paired it with what we call fast track labs, so that if there are labs that need to happen, like strep tests for a sore throat or flu tests or those sorts of things, that we can still do it in a convenient way. So, alongside that telemedicine visit, you're able to come at a convenient time later that day, drive up, get that test, and drive away, and know that we'll call you with the results and any medications or any treatment plan that's necessary. So super convenient for families. And it also helps you stay out of the clinic, because we get it that there's still concern for people waiting and being in the clinic space is, there's still some concern there. So we want to make sure that we have lots of different opportunities to make sure that your kids are well taken care of.
Yeah. And I know, sometimes before you take them, you just really need to know if it's kind of like, should I really be taking a specific risk? Like, is this really stitch worthy? Like, what are we working with here? Right. And so I think that's so important for families. So who all can access the telemedicine through y'all? What does that look like?
Anyone, any new established patients. And the really nice thing about telemedicine for us is that it's us. We're not sending you to some other, doctor somewhere that we don't know. You're going to see someone that you normally would see if you come into the clinic. So we're seeing patients over telemedicine. We're seeing them in the clinic. It's the same doctors. You're getting the same care that you would otherwise get. So that's something that makes our telemedicine particularly special. So that's nice. And also, the nice thing is, even if we can't manage it over telemedicine, it's okay, right? The nice thing is that it's super convenient for you. And you're exactly like you said, sometimes you just need that reassurance to know that, hey, this is going to be okay. I can call you in a couple of days and make sure your twins are better, or if there are issues, you can reach me. And if I see from the visit that this does not look good, then I'm gonna say, come on in, like I need to see you. And that happens. It happened to me, even within the last couple of weeks. There was a kid, and they were actually in their car, and we were doing the visit, and I saw him, and I was like, something, he's having abdominal pain. I'm like, something's, this is, So I said, can you come by? And he ended up having appendicitis, but so it's okay. Yeah, so he ended up going, having surgery that same day, but it's okay, particularly where you have such a great group of experienced providers like we do, and that there are throughout the city. It's, your child will be okay, and we'll be able to determine if it's really just about reassurance, or, hey, come in and get that strep test because it's probably strep, and then I'll call you and I'll call in the antibiotics, or no, like you need to come in and because there's a possibility that it might be more serious.
Well, I think that's something that at least has been a positive of COVID, is kind of, telemedicine and telehealth, I think, was coming around before COVID, but really this has kind of increased the bandwidth of telemedicine as kind of, the next voyage, if you will, and just providing different options for families in Houston. And so since we talk about it's available for families, what is the pricing model? Like, how do we keep it affordable? Are we going to pick up the phone and then we get slammed with a big bill later? What does that look like for y'all?
So it's, right now, yeah, you're like, that's important. So right now it's really just like any other visit, right? So if it would be billed to insurance, if you came in, we'll bill your insurance. If it's if you're on a sliding scale, then it would be billed in the sliding scale way. That would be based on your income. If it's if it's grant, then it would go to the grant. So it really is just however your visit would normally be funded, the same way it would be funded through telemedicine. And really for us, as a community health organization, we're going to see you regardless, regardless of your ability to pay, we're going to see you and we're going to take care of your babies. So, but those are important questions. But there's no like sneaky, like it's another visit. So it's treated like just another visit.
I love that. And how does somebody access the telemedicine? Is the best way to go to your website and you set it up, or
yeah, so you could even schedule over from our website, and then you would be actually right now, because there are a lot of people are new to the telemedicine platform, so we have our staff calling usually the day before or a couple hours before the appointment to help walk through and shepherd you through the process, so you make sure that everything's like what you're going to expect and how it's going to go and that sort of thing, because that's been what we found has worked the best. But it's really, really easy. Once you do it once, you're a pro. But we know there's some hesitancy about like, okay, I have an appointment at 10 and what am I supposed to do at 9:45? You're kind of stressing and trying to look through your emails and that sort of thing. We don't want that to happen. So we do have staff that can help shepherd our families through the process. But it is really easy. I mean, we have a Zoom platform. It's a special platform that's for medical facilities, so it's safe and it's compliant with HIPAA, which protected health information, and we don't want anybody like jumping into the visit and all that. So it's not the same Zoom you do when you're Zooming your friend, but it's a similarly easy platform, and so it usually goes very smoothly.
I'm so glad you brought that up, like from a security standpoint, because these days we're Zooming all the things, and I know for my kids, they have certain passwords they have to put in every time, so random people aren't hopping into their Zooms.
Right.
So that's good to know that it's HIPAA compliant, because if you're sharing confidential information about your health and going through a background, you want to make sure that it's secure and safe. So very important point. I'm glad you brought that up.
Yes.
So kind of switching gears before we wrap up,
okay.
Obviously, pandemic has been a little hard for adults, a little bit hard on the adult side. And, I think we've been dealing with it the best we can. I know, for myself, haven't been exactly the best version of myself the last 5 or 6
That's
months.
okay. I think
But
that's everyone.
what are some concerns that pediatricians have about emotional and behavioral health of the impacts of this pandemic and how it affects our children and their learning and just their home environment just being totally upshifted one day? I saw a meme the other day, and I'm sure some people have seen it, where one day I picked my kids up from school and they didn't go back for 6 months. Even adults would have a hard time processing not seeing their friends like that.
Right.
And so I would love to hear kind of your input on what you guys think about all of the effects that this is going to have on our children. I'm sure some that we won't see for years.
Won't even know. Yeah, we won't even know for a while. But definitely, we've seen some increases in depression and anxiety in kids, particularly teenagers. I think for the younger kids, it's there's still issues that they will have, but it's that security. So as long as they have a secure space at home and they see that you're okay, it's okay to share the emotions. It's okay to get upset, maybe more than you would and not be the best version of yourself, like you mentioned. And then just explain, it's hard because that way you're verbalizing things that they may not be able to verbalize. So that sometimes you might be sad or sometimes you might be frustrated or angry. And it's okay to say that. It's okay to say that's been hard. And that way they see you modeling a healthy way to kind of work through your emotions. So just making sure for the little ones, the elementary schoolers and toddlers, that they want to know that they're in a safe space, that they're going to be taken care of, that you're going to be there to protect them regardless of what happens. And then for the teens, just keep an eye out on them because those are the ones that have really, we've seen, like I said, more of the anxiety and depression because, that's when you're getting older and that peer group becomes more and more integral part of your life and becomes more important in your life. And so if you're not able to interact with those peers in the same way that you would developmentally during non-pandemic time, then that can be really difficult. And you still, as a teenager, you still don't have that adult ability to be able to process your emotions in ways that are like 100% healthy. Not even adults can always process their emotions in ways that are 100% healthy. So we definitely have to keep an eye out for changes in our adolescence. And sometimes it's, for depression, it's not always sadness. Sometimes it's anger, with, being more withdrawn. And so they can show signs of depression in different ways than adults typically do. So just kind of keeping your eyes and ears open for those signs, and then having those open conversations with them, to say, this is a tough time. And we're gonna make it through. We're gonna do the best that we can. Same with school, right? I mean, there are things that they've missed. There are things that they missed last year. There are things that they're going to miss at the beginning of the school year this year. But we're focused on health and safety and making sure that they're healthy enough to go back when everybody can go back. And that's where our number one focus should be. And everything else is secondary. And so that helps to bring our stress level down a little bit too, when we can look at it in that broader perspective.
I think it's so scary because we just don't know. So if you see, what would be your recommended, let's say you see your teen getting a little more angry, or doing things that may be out of, characteristic, what would be your suggestion? What's your next step as a parent? If you're starting to see those things, besides having the open dialogue, because I have preteens, if you will. I don't know if you count 10 as preteens, but if I ask too many questions, I'm immediately shut down. And so I guess, would you recommend talking to your pediatrician? What would be the next steps if you're starting to see concerning signs before it gets to a point that's a little more scary?
Definitely. I get it. And I have a 13-year-old too, so I understand that you get this shut down. Yeah. But yeah, so I think definitely, that preventative care, we screen all of and most pediatricians' office will do screening for depression and anxiety just at baseline at the preventative care visits. So that's always, really important. And, it's hard, right? Because you're going to see changes anyway, right? I mean, you're going to see changes because they have changes in their life. This is not normal for them. And so they may have some signs that, where they are being more frustrated and where they are being more angry, but really thinking about or looking to make sure that they have they're future oriented, right? Like that they're thinking that things will get better, like that there will be a time when they will get to go to school. Or if you say, oh, it looks like you're going to resume in-person school next week, and they yippee, those kinds of things that you're looking for, that there's some light at the end of the tunnel. That's really important. Or they're really excited because they get to have a socially distanced, outing with their friends, and they're like, yes, you see those happy moments, and that they can recognize that there's positive things in the future. That's really important, even within the changes. But open communication is important. But yeah, in teens it is difficult. But if you see that they get happy about those future things that they would normally get happy about, or maybe even getting happy about things they wouldn't normally get happy about, that's okay too, because it's so different right now, right? Those are all positive signs too. And yeah, talking to your pediatrician if you're afraid, or concerned, because your kid's the best. I always tell families, you know your kid's the best, and you're with them much more time than I am. And so if there's something that you're concerned about, that there's probably something there. It may not be as serious, as major depressive disorder. But either way, it's important to address any concerns, that you have about your kids.
Yeah, I always say, that mama instinct is basically the best gift we've been given. And that gut that you just know something's just not quite right. I think sometimes mine at least can go a little crazy. So I do need people to talk me down a little bit.
That's okay.
Or I automatically shoot to the worst case. But that's a mama.
Right. And that's good though. It's good to have it be a little bit sensitive, right? Because you want to be able to catch stuff, and even if you caught it, but hey, it really was okay. That's okay too.
Yeah, the tuned in, dialed in is, I think really important.
Really important,
well,
right?
I know we're kind of reaching the end of our time. I feel like with all of this stuff, there's so many questions to get to that parents still have, especially as so many are facing in the next month or two going back face-to-face instruction and what all of that looks like. So maybe we'll do this again and go through once we've been back in school and kind of know what that's all going to look like.
There's going to be so many more questions then, for sure.
So I'm sure there will be a plethora of why is Bobby switching his mask with
He went with Spider-Man and came back with Batman. Do I need to get tested?
The meme I'm talking about is awesome. I'm like, they share everything. Do you want Oreos for your... well, thank you so much, Dr. Jones. So just as a reminder, where can people find Legacy around town here?
Did you say where can you find it?
Where can we find Legacy Community Health around town?
So
what parts, what's the best way to get in touch with you?
Yeah, so we're all throughout the Houston area and in Baytown and Beaumont. And our website is legacycommunityhealth.org. So if there's a site near you. And actually from our website, you can schedule online, and you can do your telehealth, like we talked about before, online, and you can get lots of great information. And we have lots of great information for patients, for families, for parents. And so it's just a great resource.
Yeah, I was looking earlier, y'all have a ton of information out there, and then also kind of what to expect when you sign up for your visit and make your appointment and all of that. So super impressed. Dr. Jones, it has been a pleasure. I hope you have a great rest of the day.
You too.
For all of my followers. And I am going to drop information about Legacy in the comments below, including some blog posts that we've written. So make sure you check out those resources. If you have any questions, we'll make sure to get them to Legacy. and they can come back and answer those as well. So thank you as always for joining in, y'all. And until next time, I will see you later. Bye.
Thanks for inviting me.
Absolutely.